Hi, good day. So today we are interviewing Kelly from Next Bio. Um, she and I will be discussing, or more or less, I will be asking her questions about PGT-M, which stands for Pre-implantation Genetic Screening for Monogenic Disorders. Please tell me if I butchered that, Kelly.
No, that's okay. We'll go through it as we get through the questions. Thank you so
Yes,
much for having me
yeah.
and giving me this time to discuss with you.
Yeah. So, Kelly, my first question is more or less if you could tell us just a little bit about yourself and also about NextBio.
So my name is Kelly. I'm the genetic counselor that works with the team at Next BioSciences. I also work in private practice, and at Next BioSciences, we have a firm focus on reproductive genetic testing. So the different genetic tests that you can do along your reproductive journey, from preconception testing all the way through to testing of embryos and during a pregnancy, or if sadly there's a pregnancy loss.
Thank you very much for that information. So, to move along, I will be asking you a first question. After a couple is identified as carriers through carrier screening, what are their reproductive options?
So, just to recap, carrier screening is a test that couples can do when they are in the planning stages, so when they're planning to start a family, and it's a test that's looking to clarify the risk of specific conditions for future children. In some cases where we find that there is a risk, many times we won't find any risk, but if we do, the couple have a few options that they can consider. So they could either consider conceiving naturally, knowing that there is a risk, and then testing during a pregnancy, depending on what the condition is, or they can choose to go a different route where they would do IVF, so in vitro fertilization, where embryos are created, and we can then test those embryos for the specific genetic condition that we know they could be a risk of for their future children. So that process is, as you mentioned earlier, called pre-implantation genetic testing for a monogenic disorder. So it's a bit of a mouthful. We
Mm,
usually refer to PGT-M for short.
okay, okay. Thank you for that insightful answer. My second question to you is what is PGT-M testing and how does it differ, from PGT-A? I know you touched on it a little bit, if you wouldn't mind just going into a bit of detail for us.
So PGT-M, so both PGT-M and PGT-A are tests that we can do on early stage embryos created through IVF. So for both tests, an IVF process is needed. Embryos are left to develop until around day 5 or 6. They then biopsied. With PGT-A, so that stands for pre-implantation genetic testing for aneuploidy.
Mhm.
And aneuploidy means incorrect number of chromosomes. So there we're looking at the chromosome makeup of the embryos and the cells that we get for testing. So we're looking for extra or missing chromosomes. And these are usually things that are sporadic, so they're not inherited from one of the biological contributors. Whereas with PGT-M, we're looking for specific genetic conditions that we know there is a risk for. So
Okay.
it's not a general test that we can do for everyone. We would only do it if we know that either the couple's been identified as carriers, let's say for cystic fibrosis. So there's a 1 in 4 chance that each
Yes.
embryo or pregnancy could have cystic fibrosis. So we have to know about the condition, and we have to know which gene is involved and which specific gene change we are testing for to be able to offer PGT-M. Whereas PGT-A is something that is done in specific cases where your fertility doctor may be considering adding that into your IVF treatment to check for the presence of chromosome problems, but those are not inherited.
Okay. That's very fascinating. I find it's new to me, but I find it very fascinating just listening to you. And then my next question is, what does the process look like and how long does it take from screening to embryo transfer?
So the PGT-M process is a little more complicated. There are a lot more steps that need to happen. So from the point of a couple where they are identified to have a risk, so that could be through carrier screening, it could be because one of them have a specific genetic condition or there's a family history. What we then do is they would usually meet either with a genetic counselor or with their fertility doctor. We then ask for, at Next Bio, we ask for all the reports of the genetic testing so that we can review that. So we need to look at the specific gene change, and we review it with the PGT-M lab that we work with. And then we see, do we need any DNA samples from other people in the family? So it gets quite to be a complicated
Wow.
process with
Yes.
PGT-M. We often need DNA, so we always need DNA from the couple. If they've previously had a child that's affected, we may ask for DNA from a saliva sample from the child or from other family members, depending on the condition and how the family structure or how the family is structured.
Yeah.
So we do all of that, do the workup, and once the case has been accepted and we've reviewed and said, yes, we can proceed, they would meet with a fertility doctor who would do their IVF treatment. We get their embryo biopsy samples, and then we send everything off for the genetic testing process, which can take about 4 to 6 weeks. So
Okay.
usually when I'm speaking with couples who are considering PGT-M, I say you need to allow yourself about 3 to 4 months for this process because there's a lot of review that needs to be done from a genetics perspective. I would meet with a couple, we talk about the family, who we need DNA samples from. You need to meet with your fertility clinic. So we work very closely with the fertility doctors as part of this process to time. Obviously, they need to plan the IVF cycle. We need to know when biopsies are coming in. So that process does take some time.
Yeah.
Whereas some of the other tests are quicker because it's done as routine as part of your IVF. With PGT-M, we need a little more time to be allowed for the process.
So it's quite an in-depth process.
Much more in depth, much more, I want to say not complicated, but there's more things that we need to consider. And we need to, so I spend a lot of time going through that with patients, making sure the clinic is up to date on what needs to be done so that everybody has a clear idea and picture of what's going to be happening next.
Thank you for that explanation. And then my last question to you is, are there limitations on which genetic conditions or mutations can be tested using PGT-M?
So not necessarily limitations, but as I
Mhm.
mentioned, we review all the cases. So anybody that's considering PGT-M, we look at the specific condition, the gene and the gene change that's involved. Some cases may be technically a little more challenging than others, depending on the condition. And we would review that with a PGT-M lab, and they may give us a few different options to consider that we would then discuss with the couple. Sometimes, depending on the condition, so there is criteria for which conditions we can offer PGT-M. The condition typically has to be considered serious. Now, obviously, there's lots of definitions to that, and we can sort of discuss how we decide which conditions we offer testing for or not. But we would review that each on a case-by-case basis. We look at the family history, all the test results, and then review it with the lab. So limitations, not necessarily, but sometimes we would say this specific condition doesn't meet the criteria for offering PGT-M, or if there are technical limitations, it may just be a little more challenging where it takes a little bit longer. But we discuss each of those cases sort of individually, and that's why
Yes.
PGT-M isn't necessarily there's no clear one size fits every case is individual and
Yeah.
personalized because it gets so technical.
I was just going to say that it sounds like it's a very individualistic process.
Absolutely. So for every couple going through the process, it may look a little different because
Mm.
there's so many different factors that we look at. So the
Yes.
condition, the family structure, all these different
Yes.
things play a role in terms of how long it's going to
Yeah.
take, and how we're going to work through the challenges.
Yes. This sounds very interesting. And Kelly, sorry, I've got one last question which wasn't on the sheet, but do couples approach you directly, or do they work through their fertility clinics?
Both. So we see
Okay.
couples approaching us directly or through their fertility clinic or through their genetic counselor. So
Okay.
often, if couples have had genetic testing for whatever reason, the genetic counselor will discuss PGT-M with them as one of their reproductive options.
Okay.
So they will go through all the options that are available to
Yes.
them. So prenatal testing, so testing in a pregnancy, the PGT-M route, and if a couple decides PGT-M is the option that they'd like to consider, the genetic counselor may put them in touch with us. Or a couple may go to their fertility doctor and say, we have this genetic
Mm.
condition. What are our options? And then the fertility team reach out to us. So we get a variety, our referrals from a variety of places, but generally from genetic counselors or the fertility teams.
Okay. Thank you so much. This is a really interesting topic today. I wish we could talk more about it, and maybe we will in the future. Um,
Absolutely,
yes,
anytime.
yes. Kelly, can you tell us how we can reach out to you? Should anyone be interested, or how if you're going through IVF and you'd like for your IVF clinic to work with you, what are the
So the
steps to get
best
hold of
way to
you?
reach
Yeah.
So the best way to reach us is probably through our website. So the
Okay.
Next Bio website, which I'm sure you can share the link to.
100%, we
Um,
can do that.
yes. So that's probably the best way to get hold of us. And on the website, you will find our contact details on there. Many of the fertility clinics will have our details also, and you can just mention that you've seen this and that you'd like to get some more information. My contact details are also available, and I'm always happy to take questions if there's anything specific people would like to know.
Yeah. Thank you so much for your time today, Kelly.
A
Thank you for
pleasure.
joining us and making the time.
In time. It's lovely to chat to you. Thank you.
Thank you.